Good morning, everyone. Thank you for taking time out of your busy day to attend ADAP 101. My name is Emily Bean, and I manage the Main Care HIV Waiver Program. We did a little poll for folks that registered for this training, and the majority of attendees were only somewhat or not at all familiar with ADAP. So the goal of this webinar is to give practitioners and community providers just a quick general overview of the ADAP program. We hope to have time for questions at the end, but please feel free to type any questions into the chat or raise your hand and we will try to monitor that. This is being recorded. And joining us today, we have Jillian LaPlante, CDC's HIV Program Manager. Once again, thanks for joining, and Jillian, take it away.
Hello, let's go ahead and get started. So if we can just present the first slide.
Sure.
Yeah, this is Ryan White in ADAP. Go ahead and move on to the next slide. So we are a federally funded program that services HIV clients, and we provide HIV-related health services, including the ADAP program, which is the AIDS Drug Assistance Program. We are overseen by HRSA and the HIV/AIDS Bureau. We are the payer of last resort, so we have to be after insurance and after everything else, other resources. We help cover healthcare coverage and things that aren't covered by healthcare in order to make people healthy for HIV. Next slide. So clients who are eligible for ADAP or for Ryan White Part B are automatically signed into ADAP. To be eligible for ADAP, you have to be 500% below the federal poverty line. You must be, excuse me, you must be a resident of Maine. And you do need a proof of diagnoses. If you know the patient has been referred to the Maine CDC, we do have their diagnoses, so we might not need that necessarily. I do want to note that we don't discriminate on immigration status, but that is subject to change. Next slide.
Jillian, could you just mention where clients pick up the application?
Yes, of course. So it's online. The application is www.maine.gov/RWB.
And we have that in our list.
I show that on a later slide. I do show that on a later slide so people can write it down, and I'll show like what forms are what. So that's to come.
Okay. We also have a folder of HIV resource links that people can request, and I'm sure we have it included there. Okay.
So like you asked, the applications are, there's Form A, which is the actual application for Ryan White Part B. There is a ADAP release, which is Form C. These both require signatures. And as I said before, we need proof of residency. If the client is unhoused, we can take a letter from the provider as proof of residency in Maine. We do need proof of income, but again, if they don't have income, we have Form D, which is a statement of no income. And then the proof of diagnosis. But like I said, if reported to Maine CDC, we don't necessarily need that. And Linda, if you move to the next slide, I think is when I have before I get to the next slide. So I just want to say tips and tricks. So we have learned that when you first do a Ryan White application, it can take some time. So we recommend that if you have any of the information beforehand, to fill out as much as possible. Make sure that the client, if you don't have a case manager to work with you, if you're doing it as the provider or as a not a Ryan White case manager, make sure the client has all those documents that they have, the proof of a residency, proof of income, and reminder that you can use Ryan White. I'll talk about this later also, but Ryan White has $50 food cards that the client can pick for Hannaford, Shaw's, or Market Basket. And you can use these as an incentive for clients to come back to the clinic and get their medications or come back for their appointments if need be. Next slide. So this is the website. Oh, I forgot the DHHS part. maine.gov/DHHS/Maine Ryan White Part B. And these were all of our forms are at this website. I'll go back to this a few times. But as you can see, they're the Form A, Form C, Form D, and they all are in English, French, Kinyarwanda, and Portuguese. And next slide. And now I'll talk about the AIDS Drug Assistance Program, which encompasses insurance for people living with HIV. Next slide. So again, you have to be 500% under the federal poverty level. It pays for formulary medications. It also pays for insurance premiums for clients that have private or employee insurance. And it can also pay for HIV-related labs that are not covered by primary insurance. Next slide. So, go back. So I just want to touch on this again. All the forms for Ryan White and ADAP are all on this one slide, on this one website. These forms are for if you need to apply for premium assistance, whether it's a private employer or whether it's for employee insurance or whether it's for private insurance, whether it's coverage for labs, coverage for main care premium, coverage for copay, they can all be found right at this one place. Next slide. So ADAP wraparounds whatever insurance the client already has. If it's not covered by the insurance they already have, it is quite possible that ADAP could be covering whatever. If there's a copay from the private insurance or copay from Medicare, ADAP can cover that copay or cover the medication if it's not covered, depending on what it is. If the client does not have insurance, it is the priority of ADAP and the Ryan White Part B team to sign them up for insurance, and we will keep track of when special enrollment periods are so that we can get that client signed up for insurance as soon as possible. So in order for ADAP to pay for insurance premiums, we must have invoices at least less than 6 months old for marketplace plans. And for employee plans, they must be for each month. If someone does not certify for ADAP, we cannot pay for their premiums until they recertify. Releases for premiums must be no more than 1 year old. And we need these releases in order to pay the premium. So it's very important that we get these releases up to date every year. So Maine Care offers what's called SBW, which is a special benefits waiver for people living with HIV who don't qualify for full Maine Care benefits due to their income. It does have a premium and copays. So people who do have the special benefits waiver are able to, the ADAP is able to cover the copays and premiums for these members. Next slide. Again, I'm not going to talk a lot about Maine Care because this is not my forte, but Emily Bean, who introduced me, and Michelle Pepin, who's also here, are the Maine Care people, so you can reach them here. So these are the labs that ADAP can cover. Again, this is after primary insurance has already paid for their part of the coverage. The bills can only be 90 days or less. And it must be itemized and show what the insurance exactly paid for per lab, so we know exactly what we're paying for.
Jillian, where do they submit those? Or you're going to get to that?
So you actually submit the lab information with a form that's on the website. There's one of the forms is called Lab Assistance, and you fill out. You just submit your lab bill, the itemized lab bill with the lab application, and send it into our fax or our email. And I'll get to that later where that is.
Okay, great, thank you. Next slide.
So as I've said, ADAP wraps around main care and Medicare Part D, and private insurances for copay insurance and coverage at the pharmacy. ADAP covers 100% of the formulary medications for uninsured. At the bottom of the screen here, you can see the ADAP formulary. It's a bajillion pages long, but we cover a lot. So if you click there, you can do a sort and find what specific drug you're looking for. So ADAP does offer a copay reimbursement program to clients who are force-filled to fill at pharmacies that are not contracted with ADAP, such as the VA. When that occurs, the client pays their copay at the pharmacy, and then they can submit a form again on that website. It's a copay reimbursement form, and with their receipt, they can get reimbursed directly to the client. This is the only time we can reimburse directly to the client that copay amount. And again, it has to be when they're required to use another pharmacy. Like the VA, or I believe there might be some Express Scripts pharmacies that we're not in contract with that we might have to pay copays for. Oh, Walmart. Next slide. So if you have problems at the pharmacy, ADAP works just like any other pharmacy card. You can call our help desk, and they have people there dedicated to help with prior authorizations, or if ADAP isn't running for whatever reason, and they'll take care of you. Clients do have their ADAP cards, so they need to present those at the pharmacy, just like an insurance card. Client assistance. So our Ryan White Part B program covers a lot of assistance for clients, including housing, food, and dental. It is a payer of last resort. It is a much lower federal poverty level at 350%. It cannot pay for services rendered more than 90 days. It cannot pay for past due balances. Cannot pay directly to the clients. This is important. Assistance is dispersed as funds are available. So it's not like every client has a set amount set to themselves. It's just when we have the funds. We do not provide emergency assistance. And unless it's a child, the bill that we're paying for must be under the client's name. The next slide. So for housing, again, it's 350% the federal poverty limit. You get $750 per fiscal year. It renews in April. That's when our grant renews. And it's a simple application and a release from and a documentation from the landlord. I want to also note that a release to talk to the landlord is helpful. It's not necessary, but it does make making the payments easier on our end. Next. So we can't pay for mortgages or security deposits. We can also not pay for hotels. We can only pay for the client's portion of the rent. And we cannot pay late fees or any financial charges. And we cannot process the form until we have all the complete documentation before processing. All the forms can be found at this website again. The housing application, housing assistance, financial assistance. Financial assistance is included the heat and electricity. And again, these are all in English, French, Kinyarwanda, and Portuguese. Food cards. So food cards are $50 from either Hannaford, Shaw's, or Market Basket. It's a simple one-page application. You can submit it right when you do the Ryan White application, and you can submit it every month after that. And you can have it directly go to the client or whatever physical address we have on file for the client. I want to note that it does limit the clients so they cannot purchase any alcohol or tobacco with the gift cards. And we're not responsible for lost or stolen cards. Even if you fill out the application early, we cannot process it till the first of the month. This is important to put what month you're applying for, so we know. It's also important to know that these cards can be used for things other than food, toilet paper, other necessities. Again, where to get these forms? They're all at this website. This is the food card application, and it's again in all four languages. And it's a very simple application. Unfortunately, you do have to fill it out every month, but it's 2 questions, and it's pretty easy. So next slide. So we do offer dental assistance as well. It's $27.50 per physical year. Again, it renews April 1st. It is a 1-page application as well as the documentation that comes along with it. And again, it's that 350% federal poverty line. Next slide. So in order for us to pay for what we can't pay for services rendered more than 90 days. We can't pay for charges for past 2 balances. We can't pay for cosmetic services, orthodontia, temporary procedures, or devices like flippers. We also can't pay for missed appointments. We can only pay for 1 visit at a time in advance. However, we can pay for multiple appointments after the fact. Next slide. So we must have a treatment plan for all the dental requests. This completes the form and gives us the itemized procedures. Again, like I said earlier, we can pay for one in advance, but we have to make sure we have everything that we need for the visit. The only time you won't need a itemized treatment plan is when they're doing the initial visit. And as long as that's notated that that's what they're going for, then we'll accept it. Next slide. We also pay for dental insurance. It comes out of that $27.50 cap. And then just a reminder that Ryan White is the payer of last resort. So if they have other insurance, they need to use that insurance first. Dental applications are also found on this website, and all four languages. Next slide. So contact info. This is our contact info. If you have questions, we ask that you email the general Ryan White Part B at maine.gov email. That way we can answer any questions as soon as possible. Our mailing address and our phone number are here as well. And the help desk number for the phone for the pharmacy. And I believe that's it. Next slide.
Cursor disappears. Okay.
Yeah,
Questions?
that's it.
Questions in chat.
I just add too that Tara did share the website, the email address, and the fax in the chat in case people want to copy and paste it or use it before we get these slides out to everyone. Jillian, we just got a question. What is the typical processing time for applications?
So processing time is 24 to 48 hours. And we'll notify the client as soon as they are as soon as the application has gone through.
I have a question about the food card.
Yeah.
Monthly application. Can that, if they don't have to fill out a new application each month?
So they don't have to fill out a new Ryan White Part B application, but they do need to fill out the food card application each month.
It's just a 1-pager, Linda, with like 2 questions.
Yeah, it's a 1-pager with like, yeah, it's literally like 1-pager. It says, and it asks like, like how are you getting food otherwise, and do you know of other resources? It's a very simple questionnaire.
Okay, great. Thank you. Can I ask another question?
Of course.
The drug formulary.
Yeah.
So does that cover only HIV related medications, or does it cover all medications?
So no, it definitely covers all HIV medications.
Yep.
It also covers medications that are related to HIV, but it also covers any comorbidities that may be related to HIV, which can be anything really. So it does cover the formulary is quite large. It covers anything from antihistamines to, inhalers to, so it covers quite a bit of medication.
Great.
Jillian, is it accurate that it's mostly like vitamins and pain meds that aren't really covered by your formulary?
Yeah, over the counter vitamins aren't covered. But yeah, anything that you can get behind the pharmacy usually is covered. But over the counter is where you get sticky.
If anyone
Thank you.
if anyone wants to ask a question by speaking, just put a message in the chat and I will unmute you. I think I have to unmute you.
Yep, and go ahead and raise your hand too, and that might signal us to call on you
Oh,
if you'd
yeah.
like to do that. Yep.
And my ADAP coordinator made a good point in the chat, and she mentioned that so some pain medications, if prescribed by a prescriber and sent to the pharmacy, we can still cover.
Questions, comments? Okay.
Okay, I guess everyone all set if we close this out. Thank you again, everyone, for taking time out of your day to attend today.
Yes, thank you.
Yes. Yep, you'll be getting a follow-up email. We'll attach the PowerPoint. We'll be posting the recording of the webinar and also giving you a follow-up survey for the same 2 questions. Hopefully you're a little more familiar with it now.
Thank you, everyone.
Thank you.